Hello and welcome to the Whitestone Clinic. I'm Michael Browning, the founder and director, and it's my pleasure to welcome you here on your journey towards healing. We're so pleased that you reached out to us. Be assured that an intake counselor will be reaching out to you very shortly. At your intake session, there'll be a number of questions that'll be able to be answered. For now, I just wanted to give you a little greeting and a thank you. As you embark on this journey, there's a couple things to know about Whitestone Clinic. We understand that you might be coming directly for therapy or you're just doing some research. If you are doing research or coming for therapy, then please ask your questions at the intake. Some of those questions may be answered here, however, and so here we go. The Whitestone Clinic, the name basically comes from a name meaning victory, and our motto is return to love. The reason we picked that motto is because we notice that a lot of our struggles and things come from an experience of not having enough love for oneself or experiencing something that doesn't feel like love coming from another. And often we need to reach out and get someone to assist us to help us navigate through the difficult times. We understand that most people come into therapy not at a good time in their life, but rather facing some feeling of insurmountable struggle. That's why you reach out for help. And we understand that as we listen to your story and try to assist you from our professional perspective. What we'd like you to understand is that Whitestone Clinic has a certain process that's available to you. We would really like you to take advantage of it and think about how it could be helpful for you. So for instance, at the Whitestone Clinic, we have close to 20 experienced and multiple experiences of therapists and counselors to assist you. Each one comes with their own story, their own training, and their own background. Overall, we do tend to have a specialty for intimacy disorders. Those are people who are struggling with certain kind of behaviors that create friction or damage in their relationships, and also the experience of being on the other side of that and feeling that kind of trauma from betrayal, etc. But we do a lot more than that. We are general therapists that also help with everything from depression, anxiety, you name it. What we want you to consider, though, is as you come into our clinic, is not just to consider the one-on-one with the therapist, but look at our holistic model. At the Whitestone Clinic, we have something unique called the comprehensive model. So this is somewhere between, when people go to rehab and they spend 3 weeks, 3 months, or what have you in the clinic, living there and working there. And then we have outpatient, which is just sort of pay as you go, come when you can. We're in between. And so in the comprehensive model, and we'll call it a modular model as well, we like to sort of build out the plan for the client over time to assist them in their journey. So that way you can achieve your immediate goals and also your longer term goals. Some of that involves fitting into what's already preset templates of things we have for people, but a lot of it is tweaking based on your feedback and your needs, as well as the approach of the therapist you choose. So one of the things I want you to consider is entering into therapy is a journey towards healing. It's not just meeting any immediate goals. If you've been in therapy before, you might have had various experiences, positive or negative. You're reaching out again. Bringing those to your therapist to help explain what those were will help you in getting the right kind of help right now from the Whitestone Clinic. As you journey and you enter into therapy, you're going to see a lot of different options available to you. The therapist is there to help guide you into the directions they have seen work for the particular type of personalities and situations that you're bringing to the therapy file. Now, the modular approach means just planning things out over time, putting it into chunks that you can achieve. Maybe it's budgetary and other considerations, but just to help you sort of see where you're at, assessing what has to go on, then looking at the immediacy, the issues at hand, trying to deal with those to put the fires out. And then it's going to be about going backwards more into understanding where it came from, what the beliefs are you're struggling with, etc., and what tools you need to remedy or heal those. Going further into life skills and development and various in-practice behaviors so that your life takes a change, not just in the therapy room, but where you live every day. And also at the end of that, to find a way to conclude things so you have ongoing care follow you up into the future, not necessarily in Whitestone, but just for your own knowing how to continue living your life post-therapy. So it's a long process. I could explain more in other videos, but that's just a snapshot of something for you to consider and something you want to be building out with your therapist, usually after you kind of put out the fire of the immediate crisis at hand. Now, another thing to consider is that we usually handle multiple files at the Whitestone Clinic. We're known for the kind of connection between therapists, so that, let's say you come in and you're facing an individual struggle and you're seeing an individual therapist, but it's determined that you probably would benefit from our course or group therapy, then there'd be a group therapist for you as well. So now you have two therapists and they'll need to talk to each other. You might have a partner, and that partner might need their own assistance. And as they get their assistance, they're able to go and get help and be able to have their file. And they too might need, say, a group or other kind of file. And then the two of you might be a couple, obviously, and seeking couples therapy, and we could provide that as well. On rare occasion, the whole family is in there in a family file. And so you can see there's multiple angles for which to approach this. And one advantage being with the Whitestone Clinic is our therapists talk to each other with your permission to help make sure that our files are on par with one another, on the same path, making sure that what's happening for you individually is assisting what's happening in a coupleship, assisting what's happening in recovery, or what have you. And so that's another thing to consider when you're coming to the Whitestone Clinic. We aren't able to fully reach out to your therapists outside of the clinic as often as we'd like. Those usually aren't included in our program, but from time to time it's still possible. Now, besides the modular approach, the holistic, comprehensive approach, and all that, we want you to consider that working in therapy is really an effort to understand yourself better and to be able to relate to yourself better, even if the problem seems to be coming from other people. And so we'll definitely guide you on all levels as per your needs and requests. That being said, this is your chance to really ask questions at the intake, see what can happen there, take advantage of all we offer. We have multiple therapists, close to 20. They come from all backgrounds and experiences, multiple certifications. We have a highly professional quality to our services for you, but we also are personal. We are human beings just like you. We've had our struggles and our overcoming of struggles. And so we bring that empathy into our service to you to assist you in where you need to go. So look and see who's available and who seems to be right fit for you, understanding that we're a very busy clinic. And sometimes the people you want to meet with are not available. And in that case, you can still benefit by the clinic by choosing another in the clinic, and you never know. But by the first, second visit, you might realize this person is just what I need for what I'm going through right now. And if all fails and you're in a wait mode for a particular clinician, then we do have our group options, our support, our online options, and so forth that you can consider. So anyway, welcome to the Whitestone Clinic. I hope you have a good journey with us. Ask your questions at intake, and we'll see you after that.